next guest is a renowned leader in the field of health, exercise, and nutrition. Joining me now is Bruce Krahn, fitness expert and the author of the acclaimed Fat Fighter Diet, which I actually contributed a few pages to way back.
You sure did.
And it's done so well since, helped a lot of people. You've literally helped people shed hundreds and thousands of pounds. I mean, across the board with respect to your readers, right?
Yeah, there's definitely been quite a few pounds shed as a result of the book and the work that I do. So I'm very, very happy about that.
Excellent. We're going to try to take some calls as well, but let's just jump right to it. One of your passions is to help people kick off the fat. How do you best do that?
Well, one of the things I see a lot of people doing is they embark on diets, but they don't focus on exercise. And I'm a big-time exercise guy. So people who work with me, they have to exercise. And one of the reasons why people say they don't exercise is because, because of pain.
Yeah.
And joint pain in particular.
Yeah.
I heard that 30 million people suffer from arthritis. And, they're feeling that they can't exercise because of this pain. And up until this time, there hasn't been a lot of opportunities for people to do something without using drugs.
Yeah.
And a lot of these drugs, like non-steroidal, anti-inflammatory drugs, can have side effects. But now I'm excited that there are some other ways that we can talk about today that can help with getting people out of pain quickly without using drugs.
For sure. Well, let's start with forming good posture. Why don't we start there? Because, you've got a few tricks for us to learn, whether you're at home right now or, maybe it's something you can do in the office. What can somebody do to improve their back posture?
Okay, the first thing, and that's a great place to start, because I always begin the consultative process with a postural analysis. And people can do this at home right now. Stand in front of a mirror, take a look, and just take a look at how your thumbs are pointed when you have your arms sitting down.
Right.
And most folks, when they're standing, they start to inwardly rotate. So they're very anterior tight. So 90+% of the population is anterior tight and posterior weak.
Okay.
So we need to focus on stretching out the tight and strengthening the weak. A great exercise is called scapular retraction. All you need is an exercise band. It sounds scary, but it's not. Okay. You need an exercise band. You can do this. I usually do it standing. Okay. You put it up over your head.
Something that does stretch, though.
That's right. And move it behind your head.
How many of those should we be doing?
Well, you might just do it for like 10, 15, 20 times, but it's not really about repetitions. It's more about getting the body to stretch.
Feeling the posture.
Feeling the posture correct.
Okay.
Proper posture starts in the mind.
It absolutely does, right? And just getting started at all. So that's a great little tip. Now, you mentioned something important. I want to come back to this.
Yes.
Joint pain. A lot of people do have joint pain. It keeps them out of the gym.
Yes.
What can they take? Because I know you're really hot about this right now. It's one of the things I believe that you think is the next up-and-coming thing. Tell us all about something that people can do right now to help with their joint pain from a supplemental perspective.
Yes, there's a great new product. It's called Fast Joint Care Plus. And it's what's really cool about it is that it's been proven to work. I mean, it works fast. I've used it myself.
We've had it on the show a couple of times.
Yeah,
Dr. Blair Lamb has spoken about it. He's a doctor trained in, he's actually a pain specialist, a rehabilitation specialist, very hot about it as well. What is in this that seems to be working? And we're going to jump to the phone lines. Natural
eggshell membrane. So if you boil an egg and you crack it open, the little white film,
Interesting.
That's what it is.
Excellent.
And it helps with rebuilding the collagen, and the cartilage and inside of your knee, for example. And it helps with rebuilding the joint itself and reducing pain. 25% reduction in pain in 7 days.
Wow, that's pretty impressive studies. On to the phone lines. We've got Gloria calling in from Vaughan. Welcome to Wylde on Health, Gloria.
Oh, hi, Bryce.
How are you?
Good, thank you. I was actually calling to get your previous guest, that product she was speaking about, the superfoods.
Sure. Well, let's see.
I just wanted to ask her, I just finished treatment for breast cancer, and I'm going to be facing radiation. And I'm just wondering, with that type of product, could I use it now? Should I wait until I finish my treatment?
I'll answer that for Julie. You can start using that product right now. It's very supportive of the inflammatory process that goes on by virtue of pre- and post-surgical, if there is a surgical component to your case, if it's not just radiation. Well, what's the protocol? Let me ask you that.
Is the protocol,
how do you mean, in your case, are you having radiation surgery as well as chemotherapy?
I had 4 rounds of chemo over 12 weeks, and I'm facing 16 rounds of radiation.
Okay. Yeah, there's no reason why you shouldn't do that. Speak to your doctor anyways, as you should at any other time, but this will help to reduce the inflammatory process by virtue of this toxic slough that builds up over time from the chemotherapy, from the radiation, of course, in pre- and post-surgical protocol. So I hope that helps, Gloria. On to Ashley, who's calling from Toronto. Ashley, how are you?
I'm fine. How are you doing?
Good, good. Do you have a fitness question for us, for Bruce?
Well, it's sort of about, well, I crack my back and my neck, and I do it, without a chiropractor's guidance or anything. And I was just wondering if that's detrimental, and just because I do feel stiff and pain, and I have pain in my back, so.
So she's got pain in her back, and you'll probably be able to give her some recommendations there. But do you know anything about this self-cracking, self-adjusting to release this nitrogen gas, essentially?
Yes.
It's called crepitus, and cracking, popping sensation.
I don't do it myself, okay? However, I do have clients that do it, and they do say it helps them tremendously. So I can't speak to it personally. I do know if it's making you feel good and your doctor says it's okay, your chiropractor is all on board, I mean, certainly go for it. But there are ways that, you can address your problems that you're having. A lot of times people have joint problems because they have muscle imbalances, muscle weaknesses, and often they're just very, very tight. Okay, and I see that a lot with people with back pain, is they're very tight in terms of their hamstrings, they're tight in their hip flexors. So working on your flexibility and then strengthening all the supporting musculature. Yoga's excellent.
Core, you talk so much about core in the Fat Fighter diet as well,
Sure,
right?
yeah.
Core exercises. Tell us about eBody before we have to go to another break. Tell us all about eBody. ebodi.com is your website. What can people find there? Because I think it's an incredible resource that, untapped.
Well, what it is a virtual personal trainer and nutritionist. It's how I can work with people online without actually seeing them in person.
So we can even show some before and afters at this point.
Yeah.
People you've helped through eBody. So we'll throw those stills up right now, the pictures on for everyone to see.
Okay, now this is Mike. Okay, now Mike, he lost over 25 pounds of body fat and packed on quite a bit of muscle, and he did that in less than 4 months.
Wow.
The next one,
Good for you, Mike.
Yeah, way to go, Mike. And then we have
Edwina, I think.
Edwina, yes. Edwina, there she is. Okay, now Edwina, really amazing story. Edwina lost 50 pounds of body fat in 3 months, which equates to 36 workouts.
Wow.
She's one of the best I've ever seen. And
what did she do? What was her secret?
Well,
other than eBody.
Well, what we did is we really manipulated the hormone insulin, okay? And I do this through, and Julie alluded to this, is that you have to eat certainly a lot less processed food. But one of the mistakes that most people are doing is they're having breakfasts that are way too high in sugar, and they're not eating enough essential fatty acids. So I started to dramatically increase her omega-3 intake. I used, actually this one, omega-3, O3 Mega Extra Strength.
It's a great product, yeah.
And we dramatically increased that. We started at 4 capsules a day, and I actually increased it up to 12.
Wow.
And she was taking 12
Finally,
grams.
therapeutic levels.
Yes,
Excellent
absolutely.
stuff. Bruce Krahn, the author of The Fat Fighter Diet. The website is ebodi, ebodi.com. And you're going to be with us at the Metro Convention Center November the 27th. You're on our panel. You're answering all questions, fitness and nutrition related as well, along with Julie, who's doing the nutrition. Yeah. We will look forward to once again gathering together for that wonderful 2-hour lecture on November the 27th. Thanks so much for joining me on the show tonight.
Thank you.
Appreciate your time. It is time for another break, and we are searching for that magic pill to slow down the aging process next. My next guest will share with you his recommendation, plus your final calls. That's coming up next.
Reach us in the GTA.